We're excited to bring to the show Dr. Loretta Friedman, the author of LymphLink. She's the founder of Synergy Health Associates. Synergy Health Associates is a private practice located in New York City, holistic nutritionist and toxicity specialist. And you know what? I'm so glad to meet you. Literally, I have so many reasons why I'm trying to become a patient. So, welcome to the show, Dr. Loretta.
Thank you. Thank you so much. I appreciate being here.
All right, we start off this way, okay? You could be doing anything in the world. You could be sailing the 7 seas. You could be climbing Machu Picchu. You might have already done that. You could be, I don't know, building. You could be in construction. Why did you decide to write this book, LymphLink, Solving the Mysteries of Inflammation, Toxicity, and Breast Health Issues?
We are a nation of breast disease. And I really want to change that conversation to breast health. Lumpy, bumpy, tender breasts are not a rite of passage for women. It's telling you that there's something wrong. You have some hormonal imbalance going on, some toxicity like a heavy metal or an organophosphate, like a pesticide that you've been exposed to that's causing this lumpy, bumpy tenderness. It's not just the way it is. So you need to, investigate. You need to tell your doctor. You need to see and find out what type of toxicity you may have going on, because these toxins lodge in our breast tissue. This study was done in 2014, proving that when they tested women's breast tissue, they tested positive for 17 different dangerous chemicals that all cause cancer and autoimmune disease. So this is why breast cancer and autoimmune diseases are so much higher in the female population, because we're walking around with these toxins, in our breasts, and nobody's doing anything about it. And it causes all kinds of health issues, all kinds of fatigue, brain fog, weight loss difficulties, digestive problems, headaches, skin disorders, so the symptoms are varied. And because they are vague, they often get misdiagnosed. They often get dismissed, or you're given medication that just makes the toxicity worse. So you need to have a cell test done. You need to have a test done that actually measures what kind of shape your cells are in. That's what I do in my office. Patients come in. The first thing we do is an anti-aging cell test. Electrodes in the back of the hand and their foot, an electrical impulse in through their body. It prints out an algorithm that correlates to cell health. I can see what kind of shape your cells are in. I can see if there are any deficiencies that are present, if your mitochondria is in the toilet, your cell energy is you're dragging your butt all over town. If your cell receptors have lost their sensitivity, you could be looking at insulin resistance, the beginning of type 2 diabetes. But most important, a shift of fluid from inside the cell to outside the cell is indicative of toxicity. So I can tell you how much toxicity you have in your cells. Not what kind, but how much. And depending on how much can lead us to what kind. Whether it's heavy metals, as I said, organophosphates, pesticides, environmental sensitivities, these all exist. There are 68 distinct cancers that have all been linked to the Twin Towers falling down 20 years ago.
What?
68 distinct cancers caused by the toxins that were released from the Twin Towers. That did not happen in a bubble. That didn't just happen here in New York. These toxins exist around the world. We are exposed to this every day. All of us. And unfortunately, some of us cannot detoxify properly. Some of us can't get our livers to bag up the garbage and take the garbage out properly with the urine and the feces. So what happens is it gets bagged up and it gets redeposited back into your system again. And it gets bagged up and it gets redeposited. This is also the reason why cleanses don't work. It's a multi-billion-dollar industry. But a cleanse only addresses pretty much your small and large intestine. Toxins are in your gut, in your liver, in your kidneys, and in your lymphatic system. That's why metabolic detoxification protocols are necessary. Cleaning your gut doesn't really do that much. It doesn't last. It doesn't have any major effect or change in the body overall. You may get a little lightheaded, you feel a little giddy, you start burning a little fat, you get bad breath, you think you're doing something, and and that's it. But it doesn't really accomplish the goal. So,
Oh my God. Takia, our mind is blown, Dr. Loretta. Let me just explain that. Like, you said that like it was ABCs, but to us, we over here like, oh my God. Because I was saying before we started the show that I literally yesterday made an appointment to get a mammogram, and then you were expressing to me that I should consider a different kind of, well, maybe that and a different kind of test.
A thermography. A thermography is a much more sensitive thermal scan of your breasts. And it also can identify congestion that goes on in your body. And that congestion is lymphatic fluid that's stuck, that isn't flowing properly. And that's due to toxicity. So that lets you know whether, you have toxins that are present and the lymph isn't draining. But the thermography can identify the early angiogenesis, the early blood supply that supplies cancer in your breast tissue. That's what you want to know about. That's what you want to identify. Okay. If a mammography doesn't show you that, they're hard to read. 40% of women have dense breasts. Thermography is not efficient. A thermography is much more sensitive, especially for dense fibrocystic breasts.
And that's me. So literally the reason, maybe like years back, long story short, went to my, under my right arm, I just had a lump that wouldn't go down. I think it came from something being backed up during breastfeeding, but that's another conversation. So I went to the doctor, and at that time I had sliding scale healthcare because I was just becoming an entrepreneur, had no healthcare. And they were, literally like digging so deep into my arm and my breast. So she's like, oh, I feel something. You need to go get a mammogram and a breast ultrasound. So I got a mammogram, the breast ultrasound, and the woman was just like, you have very dense breast tissue. So that there's nothing in there, but it's still just very dense. And breast cancer runs in my family on my dad's side. And so I'm like, oh my God, now I have to go every year. I'm supposed to. I am going to go this year. But now I'm like, well, where's the line that we call to get an appointment, Dr. Loretta, to your, because I need to come see you. I'm going to.
Oh, you can come see me. Synergy Health Associates is my website.
Okay.
You can make appointments on there. It's a direct contact to me. You can ask me any questions that you like. I talk to everybody. I get back to all the patients. There isn't anybody from, the middle of, excuse my French, BF, Georgia to little towns in the Southwest that haven't seen healthcare in 20 years. I talk to them. So, I answer their questions. I tell them what they need to do and how they can help themselves, especially because they can't get to New York City. So,
Dr. Loretta, see, I'm blown away. And, Dr. Loretta, I write a lot of notes. I take notes. I write things down. And so one of the things that my question is, how do we even get to know these things? Like, because a lot of times we don't even know what to ask. Like, we're trusting that I'm going to talk to my doctor and they're going to know what next to do. But you're saying that we missing some stuff.
Yeah. Your doctor doesn't know. It's very unfortunate, but they don't know. Most of my patients do a lot of their own research. They found me because they were, looking for somebody who specialized in lymph because they were told to find somebody who specializes in lymph. They didn't know this on their own. Again, it's the symptoms of toxicity are subtle. They're not necessarily boom in your face. I get calls every month on people who have brain fog, whether it's from long COVID that they have brain fog, or they just have brain fog because their nutrition is poor, their sleep patterns are poor, they lack exercise in their life. The thing is that this could be due to toxicity. Testing is necessary. That's the thing. A cell test can tell you how much toxicity you have in your system. And from there, then we'll know whether your history supports doing other tests, a stool test, urine test, saliva testing for hormones to see what type of toxin you have. And once that's identified, it can be removed. It can be relieved. It takes a little bit of time, takes a little bit of work. It's not a one and done. But you can start feeling better. The symptoms, when I start doing lymph drainage on patients, hand to God, people come in, they have a pain level of 20. One session, pain level goes down to 2. Okay, so this is them telling me. They're like, "Oh my God, why didn't anybody tell me about you?" I'm like, because they don't know. They don't know that I exist. They don't know that I'm here. They don't know that this type of lymphatic treatment, lymph biologics, exists. That you can rid the body of swelling and inflammation and lymphedema with doing lymphatic drainage with a 3-part light wave and an oscillating frequency that helps to relieve toxins, as opposed to lymph massage, which kind of pushes the fluid from point A to point B. It doesn't get rid of the underlying toxicity, so it doesn't really get rid of the lymphedema on any sort of permanent basis. And removing the toxins. The toxins are key. That's the part that everybody else is missing. You have to get rid of toxicity in your body if you want to get rid of swelling, inflammation, and lymphedema, and you want to restore your health. So, anything, people experience swelling and inflammation all the time. You sprain your ankle, it swells up like an orange or a grapefruit, right? In like 4 to 6 weeks, that should go down. That should go away. You may have some distortion of the ankle because you damaged the soft tissue, but it shouldn't be, your whole leg and ankle shouldn't remain swollen 8-10 weeks, afterwards. Then that's lymphedema. When that swelling is when your 2 legs do not look the same, you know what I mean? Something is wrong, and some doctors do remove the fat from the larger of the limb, trying to reduce the size. The problem is that the surgical procedure causes swelling and inflammation, so it doesn't make any sense. You know what I mean? It's not, you can do conservative treatment and get results. You don't need to do invasive stuff.
Take us back a step. How did you what really sparked your interest in becoming a holistic doctor in this way? Where did it start for you?
I do a very specialized chiropractic technique. It's called directional non-force, which means I don't do any rack 'em, stack 'em, or crack 'em. I don't pop or twist anything. It's a very gentle, very effective form of chiropractic. I utilize a natural reflex of the body to identify where there's nerve interference, bones out of place, what we call subluxation, so I can correct them. So I always tell people I just look like a big brute because I grew up in Brooklyn. So, but it's really a very gentle technique. This technique focuses on disc and disc pain and disc problems, sciatic stuff. I get rid of pain that in 6 or 8 visits that most chiropractors can't touch in 70, 80, 100 visits. They don't get the kind of relief that I can provide. Patience is not a virtue bestowed to me. I have lots of other virtues. Patience is not one of them. So, when people didn't get the kind of results that I thought they should be getting and that I expected them to get, I looked at myself first to see, am I doing something wrong? You know what I mean? Am I missing something? What's going on here that this is not working? And what I realized was that they had a lot of inflammation, and I could see that inflammation because the ligaments and the tendons were stretched out. Okay, they had anterior movement of their vertebra and their discs, which is indicative of a lot of inflammation being present, that these rubber bands that hold vertebra to vertebra together that stretch and come back and stretch and come back, these stretched and they stayed that way. They stayed stretched out. I started looking at the inflammatory process of the body, and I started doing research. And actually, one of my vendors at the time had been to a trade show and saw this device, for lymph drainage. And I, ran with it. I called them up. I went to South Dakota. The only thing worse than South Dakota, is North Dakota, right? Okay. So.
My God.
Yeah. I've never seen so much cheese on food in my life in South Dakota. It was like, you want cheese with that? Yeah, okay. So I went there for a week's worth of training, and I've been doing lymph drainage ever since. and my knowledge base has increased over time with patients, with learning. And initially I did it on the down low because, I believed there was toxicity in the body, but everybody looked at me like I had 6 heads. So I limited the treatments to mostly musculoskeletal patients, people who came in with hot discs, hot low backs, pain, and I could get rid of that swelling and inflammation within a week. People were walking and standing and, miraculously. It wasn't until 2014 when the study came out showing when they tested women's breast tissue and it tested positive for 17 different dangerous chemicals that all cause cancer and autoimmune disease that I started banging my drum really, really loud because I'm like, I'm right. I'm smarter than I look. Shit, look at this. I've been talking about this for years. It's real. It's not just in my head. So I sent out information and packages to every major hospital, every major alternative program in all the hospitals around the city. I won't name any of them. Nobody got back to me. Nobody cared. Nobody was interested in the fact that, I'm talking about something that's very real, that has a real effect on patients and can relieve pain and swelling and inflammation and give them back their lives to an extent. And nobody cared.
Why do you think that is? Like, why do you think that it feels, is it commercialism? Is it just like all about the money? Like you would think
I have a couple theories. The money. It's also because these institutions don't want to go outside whatever the AMA practices are. So the American Cancer Society, Susan G. Komen, they won't do anything that isn't medically approved. They won't. It doesn't matter if it works. Unless, something happens to one of them personally and they experience this themselves and they take it into their organization or they take it into the people who run this, it's never going to change because it's all about what, the medical community accepts. And I do believe that unfortunately, other practitioners, if it's not putting $1 in their pocket, they're just not interested. They're just not interested. And that's a shame because you want to help the patients. It's all about the patients. It's not about the doctors.
And you know what, Dr. Loretta, that really, I'm glad you said that because it really makes me sad. We've been having conversations about women's health, and like health disparities and that sort of thing. And that's one of the challenges, Dr. Loretta, that we're facing is that we're going into our health practitioners and we're saying something is wrong. Now, I'm not a medical person, like I just know my body and I know something is wrong. And, you said offline, and I kind of want you to just repeat it when you were talking about how many seconds we have to tell our doctor what's wrong and to get some help.
You have about 21 seconds to tell your doctor what's wrong with you or what you think is going on with you or what you're here for. Until that's it, over. So
is that because they stopped listening? Like what? Like when you say that, what?
Yeah, pretty much. You know what I mean? It's like their wheels are already turning, and they're deciding what script they're going to write you, and how many people are in the waiting room, waiting to come in. So and you better be succinct because if you're not, they're going to cut you off, and it's like, well, this is what I think. And, like I said, they're not listening. So one of the things that my patients like about me is I listen. I really do hear them. I pay attention. I ask a lot of questions. I have a young man who came to see me. He's 27 years old. He had been to a slew of doctors for years. Swelling and inflammation in the joints, swelling and heaviness in his thighs, his left foot swelled up. He was very, very competitive, athletic, big boy, muscular boy. Lots of sports, lots of activities, could practically do a full split on the floor. Comes to see me and I do a cell test. He doesn't have an ounce of toxicity in his system. I'm like, ooh, what do I do now? I'm like, okay. He's got all the symptoms. of toxicity, but he doesn't have any toxins. I asked him a ton of questions, and I said to him, I said, I think, and he had been to doctors who were like, well, we can inject all your joints, and if that doesn't work, we can do surgery. I'm like, surgery on what? They don't know what's wrong with you, but they can do surgery. I said to him, I think you have overuse syndrome. I think you played so hard, and your body is trying to protect itself. That's what swelling and inflammation is, that your body is sending lymph fluid to your joints to try to protect them from further damage. And you know what I mean? You keep trying to work out, you keep trying to do things, and it just keeps getting worse and worse and worse. I said, I think you really need an adjustment to put everything back into alignment, to let your lymph start to flow properly. And I'll do some lymph drainage so we can get rid of whatever extra fluid. He's good. He's after three adjustments, he's sleeping. All the joint pain is gone. He has no swelling and heaviness in his thighs anymore. His left foot doesn't swell. Now I'm trying to, teach him how proper body positions, postures, and things like that, because he's doing a few things that are not good for him, to keep him in good alignment. And so, and he can go back, and he's just started going back to working out again. And we're monitoring him, little by little, seeing if what he does causes damage. And so we need to modify it, not necessarily stop, but modify it, alter it for him. So he can be active.
Wow. So in your book, Lymph Link, total book title, Lymph Link, Solving the Mysteries of Inflammation, Toxicity, and Breast Health Issues. I think the toxicity, the inflammation, and it sounds like what I'm hearing you say is there's so much information that the breasts hold. Like that we're not even giving the breast enough clout, I guess you could say, in terms of all of the information and how informative the breast can be, because I think when I look at, I want to hear you talk a little bit about Lymph Link and the links we talked about the toxicity in those links, the links of the breast out to the body. I heard you talk about the information around how the body's trying to protect you. That's so interesting, because I don't think that we're taught as women that breasts are that informative. It's almost like, it's just a tool in case you have a baby. It's gonna fill up with some milk. You're gonna probably feed them. You know what I mean? And that's about it. You know what I mean? Other than sexual pleasure.
Correct. Absolutely. I wanted to call the book Your Tits Are Talking, but nobody's listening. They wouldn't let me.
I love that. That's the brochure. That's
the brochure. I like that one. That's the TED Talk. That's the TED Talk.
There you go.
The publisher wouldn't let me. My agent wouldn't let me. I asked. She's like, no, you can't do that. I'm like, okay. So, but yes, that's the whole point. The point is that your breasts are important, and they're being overlooked. And because every woman has breasts, you know what I mean? It's not like, we go anywhere without them. They go with us. They're exposed to everything we're exposed to, and they are talking to us. They are telling us things. And unfortunately, the medical community doesn't know what to do with that information. So it gets ignored. It gets passed over. It's just the way it is. But I have tenderness and lumps and every month. Well, that's your period. Well, yeah, that's telling you that there's some hormonal imbalance going on. Maybe you have estrogen dominance. Maybe you have really bad PMS. These things can be fixed naturally with supplements. I can't tell you all the 20-something-year-olds that I see that come in with acne all over their face. They have bad periods. They have estrogen dominance. I put them on 2 supplements. Face clears up 100%. You know what I mean? Change their diet a little bit, alter, some lifestyle stuff, and the PMS goes away. No more terrible periods, no more back-breaking, periods, no more in bed for 3 days, they can't move periods. It's not hard, but you need to listen. You need to hear what's going on with the patient and, make appropriate changes. Diet, lifestyle, supplementation. So, the breasts are definitely being overlooked. That's why, like I said in the beginning, we are a nation of breast disease. I want to change that conversation to breast health. It doesn't have to be just breast disease. Health is right around the corner. You got to listen. You got to pay attention. You need to take action. You need to do something, for yourself, to help yourself. That's why I recommend thermographies for all my female patients, because a thermal image is much, much more tell-all than a mammography, and especially for dense breasts, as we mentioned earlier.
So, Dr. Loretta, like, just thinking about this, like, as women are listening and they're tuned in and they're like, okay, so what should I be doing? You know what I mean? Like, what can I do to ensure that, that I'm asking the right questions when I go to the doctors, that, that I'm taking responsibility for my health, whether it be, with what I'm eating, and that sort of thing. What, some quick things that we can do to promote healthy breasts, healthy lymphs, and basically a more healthy lifestyle.
Well, what you said, in terms of taking notes, women should journal. They should write down what it is that's going on with them for, a 10-day or a 30-day time period, day by day. You know what I mean? How did you feel? Woke up in the morning, I had a headache, went to bed with a headache. You know what I mean? I broke out with a rash. I didn't sleep well last night. Because you need to look at that. You need to see what it is that's going on with you. Not just your fob, you know what I mean, that you're keeping track of, you go into REM, at night. But, how are you feeling? What did you eat that day? Okay? Food plays a very, very important role in health. Okay? Food is medicine. And one thing that I tell my patients is that they need to really remove inflammatory foods. Okay? Inflammatory foods are basically white foods, white flour, white sugar, white dairy, white potatoes. You want to eat colorful fruits and vegetables all the time. So, these are the things. Exercise, key, exercise. You need to move, okay? The lymphatic system does not have a pump like the heart, okay? So the only way the lymph moves is with muscle movement, going up and down stairs, walking, doing yoga, even breathing exercises moves your diaphragm and moves your upper body muscles. So the lymph starts to move a little bit. And you have to drink a lot of water, okay? Most people are dehydrated. So if you're thirsty, you're already dehydrated. So, you know what I mean? It's like if you're looking to drink water, you're already dehydrated. So you need to keep drinking all day. And it needs to be filtered water, okay? Not, what's that water?
Tap water, not tap water.
Spring water. Wait a minute. Spring water, doc. No, don't tell me I can't drink spring water.
No, spring water, as long as it's filtered. You know what I mean?
Okay.
As long as it's filtered. Okay. So, but just water. You don't want to drink water out of plastic, okay? So you really want to try to find water that comes in paper packages, paper containers, because the plastic is estrogenizes, especially in the heat. So, all these men and women who can't seem to make babies anymore, I keep telling, it's like, do you think people forgot how to shtup? You know what I mean? They know how to, they know how to get it on. It's the estronization of men because of all the plastics. They're you know what I mean? They're internalizing, and they can't get rid of these estrogens in their body, and it lowers their testosterones. So, and women, same thing, but it creates an inflammatory process. So it creates a hostile environment, to try to get pregnant because you have too much inflammation going on. So yeah, you want to try to drink beverages, especially water, not in plastic, in paper, if possible.
Mind blown. Where you at, Takia? You all right over there?
No, I'm not okay. I am not okay. Okay, because now I'm over here. Now I'm like, okay. So now I done wrote down I got to get rid of all my white foods. You know how I feel about a good potato. So now I'm like, okay, maybe I need a red potato. That's what I was doing. Dr. Loretta was over here. I was over here like, can I eat cauliflower? Because you know what I mean? I like cauliflower. Yes, is that a good one?
Except for eggs and cauliflower. Those are the only white foods that, you can continue to eat.
Okay.
Okay. You want to eat. Because
potatoes, right? Sweet potatoes, purple potatoes, Japanese yams. There's lots and lots of stuff out there. The white, russet potatoes and the Yukon Golds, not so much. Okay, so, and white flour, so breads and cakes and pastas and cookies and, all of that stuff. It's all highly, highly inflammatory.
Well, listen, what are we gonna eat, Doc? What are you taking?
There's so much food out there to eat. There's so much choice. Listen, the whole world didn't become celiac. Okay, the whole world didn't become sensitive to wheat. It is the pesticides that are on the wheat that everybody's reacting to. It's not the wheat. Wheat isn't even wheat anymore. It's so genetically modified. It's not when I was a kid or you were a kid, that they made wheat. It's not like that anymore. I don't even know what it is, but what they stick in these silos and they spray with all these chemicals so it doesn't get moldy and rotted. That's what people are reacting to. It's not the wheat. It's the pesticides that people are allergic to and they're sensitive to, and that makes them sick and it makes them tired. And, they have, I can't think of the word for the wheat. They have wheat sensitivities,
okay. Like gluten.
Gluten, there you go. That was the word I was looking for. Right. Yeah, right. The whole world didn't become gluten sensitive. It's, it's the pesticides on the wheat that are causing these sensitivities. So, right.
Well, Doc, we could go on. I feel like I got so many. It's okay because I'm coming. Listen, I'm looking at the calendar. I'm like, what appointment does she have open? Because I'm coming. This conversation was so helpful for me personally. I'm not gonna cry, but I was literally talking to them about this morning because I have narcolepsy, and but I found through managing and I don't want to be on medication for the rest of my life. So I found that through managing my food, that I was actually like more energetic, things like that. But then I found that like today I can really feel that like all of my medication is out of my system. And so I feel a lot heavier than usual. And I was just talking to him about this and saying like I needed to find a care team, like thinking about like who do I look for? Getting a nutritionist, like finding someone to really, really help me move through this. The toxicities in the body were not even something I think I had begun to think about until you just started talking about it.
Try to eat a banana today. Banana is great brain food. It's full of magnesium and potassium, and it really helps the brain. So if you're feeling that heaviness, eat a banana. It'll perk you up a little bit. It'll give you, a little bit more energy and focus. So
okay, I'm gonna do that.
Yeah,
I'm gonna eat a banana. You got banana? Send me one down here. Send me one on over here. I'm gonna eat a banana. I'm gonna schedule my appointment. All right. And we want to make sure you can find Dr. Loretta, SynergyHealthAssociates.com. She is the author of Lymph Link, Solving the Mysteries of Inflammation, Toxicity, and Breast Health Issues. Now available on Amazon. Also available at SynergyHealthAssociates.com. You have to go to SynergyHealthAssociates.com and book your appointment. Because I am, and I'm going to tell y'all about it on social media when I do it. So make sure you are there. Dr. Loretta, words cannot express the thanks I have and the gratitude for you joining the show today. This has been super informative and super helpful.
Thank you.
Thank you for the work you do. Thank you for choosing to do this work. It is so important and will change millions of lives.